Hello, this video is going to go over tray setup and also irrigating, assessing, cleansing, and packing the upper thigh or hip wound, okay, which has a little bit of tunneling, a little bit of undermining. So first we would start by hand sanitizing. We would explain the procedure to our patient, we check our physician orders, gather our supplies that we require. We can also look back in the charting to see how much packing we're going to need for the undermining and the tunneling. And also we can provide some analgesia for our patient if this was a painful procedure. Okay, after we've done all that, we would make sure that our table is about waist height. If anything lower is considered unsterile, so we would want to make sure it's above our waist. Okay, same with the height of the bed as well. My patient is, the wound is about the side where my waist is. So normally it wouldn't be, it's elevated right now, so I would probably elevate the bed a little bit more. I would make sure that my overbed table is clean because my patient often uses it for lunch or their personal supplies, so I'd make sure I wipe it all down first. Okay. After I've got all that ready, I'm ready to open up my sterile tray. A tip that Jeannie has pointed out to me is that she takes her first corner and she unwraps it to 10 or 11 o'clock away from her. And then that way when she opens the rest of her folds, remember we can touch in the 1-inch border here. So the 1-inch border is all the way around our tray. So you can see how it's kind of a square setup now that we've unfolded. And we're gonna grab our forceps underneath so the tips remain sterile. And we can grab our 1-inch border there as well. Okay, so now from here I can't really move my tray around because anything that's fallen underneath the table is considered unsterile now. So I can't make this unsterile, so I can't move it like this and bring an unsterile part on top of my sterile tray. So I would have to keep it as it is, okay? I could move around this part of my tray though, kind of center it, and I can move around my supplies, okay? So normally I will move so that my big part of the tray is open for my normal saline, my tools, and also there's a bunch of stuff inside this tray that I can pull out as well. So for example, my sterile drape I can hand to myself, and with these forceps I've touched half of the forceps, so that has to remain out of my sterile tray. Okay, so kind of your forceps will be half in, half out, so that the sterile tips are inside your sterile field. And you could use this as a sterile drape if you want, but I usually just drape it so that maybe it will catch some of the irrigant that's coming down. And also as well, you have a garbage bag in there that you can set up. I'm gonna keep my patient's dressing on until I'm ready to do the dressing because the tray setup takes a little bit of time. I would do some hand hygiene if I touched my patient's bed, and now I'm gonna start opening up my supplies and adding it to my tray. So I'm gonna start with my 30cc syringe, and I'm gonna banana peel back. And this one, if you drop it in, sometimes it bounces around. So this one is a good one to guide on with your forceps. Put my stuff in the garbage. With that 30cc syringe, we're gonna have our 20 gauge Cathlon, which we're gonna drop into our tray. And we've already taken the needle out of it. So now we just have the plastic Cathlon. In a clinical setting, your needle would be inside of the plastic Cathlon and you would take it apart with your sterile gloves. However, because this is a used tray and we've been practicing with it, it's already got the needle taken out. So now I'm gonna banana peel back a bunch of 2x2s and 4x4s, and we're gonna banana peel away from our tray. If we did this over top of our tray and by accident, if we drop something, then we've contaminated our tray. So we're gonna banana peel away from our tray, and we can either drop this on, like that, and let it plop on, or we can banana peel and we can grasp it with our sterile tip forceps. Drop it into our tray. All right, so we would just keep adding supplies, banana peeling and adding supplies. We're going to use these for drying up the wound, and we're also going to use a couple 4x4s for over top of the wound as well. Supplies. I like the 4x4s because they create a nice big buffer for soaking up that irrigant. And my gauze are a little well used, so they're kind of flopping around a little bit, but hopefully brand new ones would sit nice and straight upright, not flop around on you. And you gotta be conscious that our flaps don't flap back and touch our gauze inside. So banana peel them back so they don't touch our gauze and contaminate them. I'm gonna add a few of my 4x4s and just keep adding. Okay, and then we'll add some sterile scissors. So normally in the clinical setting, they would be banana peel back, but in the lab, we just have a little baggie. So I'm gonna just drop that onto our tray. And then I'm gonna add a second pair as well, just in case I wanna use them with my sterile hands. I'm gonna keep them inside the center of my field. The other pair I'm gonna push to the side of my field so I can use them to cut some new gauze. Some Q-tips, some sterile tipped Q-tips. We can use those for measuring and packing. Make sure they're well within my sterile field there. Okay, and another one. So we're going to use 3 for measuring and 1 for packing. And then what else do we need here? Oh, our new gauze. So our new gauze, if this was a new bottle of new gauze, the red tape would be together still. So we wouldn't need to take a discard if this was a brand new bottle. Now I'm gonna need some scissors. So I'm going to push out a pair of scissors. If you wanted, you didn't have to drop a pair of scissors onto your tray, and you could just use them apart from your tray. But I'm gonna push them tip to tip so that they're sitting out so I can grab them with my unsterile hands. Okay, so sterile tips, I'm gonna grab some sterile new gauze. We're gonna pull this right down. Yeah, and I would know how much I need based on maybe I've done the dressing before. So maybe I know, maybe some of my charting will say how much new gauze I need. For this wound, I think I need quite a bit actually. So I'm gonna pull quite a bit right onto my tray. That new gauze, stuck to my scissors. Just pull them off my scissors. There we go. So that would be if we were using a brand new bottle of new gauze. We didn't need to take a discard. However, if this was a bottle that had been used before, I need to take a discard because the thought is the top of this end here is considered unsterile. So we need to get rid of that. So I can actually use my fingers, pull that out. And I'm at the end of my rope. I'm gonna start with a new bottle there. For your demos, you'll always have a new bottle of new gauze, so you don't have to worry about running out. At home, save the new gauze that you're using for your wound and just tuck it back in your bottle. You can take these plastic lids off and put your new gauze back in there and just keep practicing reusing them. So taking the discard, so I'm gonna grab them with my finger and hopefully I have enough new gauze in this bottle. Okay. Now this is considered unsterile, contaminated. This part is considered sterile. I'm gonna take my scissors and I'm gonna get rid of that unsterile part. There we go. Okay, if I needed to pull a little bit more, I could pull a little bit more. For this dressing, I probably would, but for an example, I'm just gonna use this much. Then I can come over top of my tray and cut that, just like that, okay? So there we are, putting our new gauze onto the tray. So now I just need to pour my sterile water or sterile saline onto the tray. So we're gonna put that here, it is here. Okay, we never want to turn our back to our tray, right? So if I was missing supplies, I would get my colleague, put the call bell on to go grab it for me if I was missing any. And we'll pour our normal saline on. We never want to leave our tray just in case something happens while we're gone. We might not know. Maybe dust falls from the ceiling. Maybe your patient gets up and sneezes on your tray or drops something and then he doesn't tell you or she doesn't tell you. And you've had a contaminated tray and you didn't know. Same thing if I've turned my back to my tray as well. Something might have happened to it and I might not know. Okay, so I've added my normal saline. And now what I'm gonna do is, I've explained this to my patient, just gonna take some clean gloves and I'm gonna take the dressing off. I didn't take the dressing off before because my tray setup took a really long time. So if in that time span, my patient wanted to get up and go to the bathroom or something, then I would have inhibited him from doing that if I took this dressing off. They would have been kind of limited to staying in bed because they had no dressing covering it. So I left the dressing on until I was ready to do it. So we can take our dressing off. We can note what came out of the dressing, out of the wound. Okay, maybe serosing, and then we can also take our packing out as well. Okay, noting what we see that's coming out. We can also save this and kind of eyeball how much we need. We can also save it for measuring as well to kind of see how much we would need. Okay, dispose of that, put it in the garbage, and we would also put our gloves into the garbage as well and do our hand hygiene. Okay. Now I'm ready for my sterile gloves because I think I've got everything set up. Everything's within my field. My patient is positioned properly. Okay. And now normally this bed would be a little bit higher as I put my sterile gloves on. Can I borrow your bed just to put my sterile gloves on? Okay. I'm just going to open up my package here. Trying to make sure that the folds don't flap back and contaminate my gloves. I'm just going to pull those on. Fingers underneath the cuff there. 3 fingers works well for me, makes it a nice wide cuff. Okay, we're gonna pull that on. And if we needed to move our package, we could grab the center of it, move it on out, or you could just leave it where it is. Okay. Now I have my sterile gloves on. I can work within my sterile field. So what I'm gonna do first is I'm gonna assemble my syringe and drop some normal saline. Okay. For this wound, it seems to be about 10 cc's works well for irrigating. If you use a bit more, then you're gonna notice you're gonna create a lot of spillage. The other wound, probably about 15 cc's is a good amount of irrigant because it's a bigger wound. Okay. Now, normally in the clinical setting, you would irrigate until your irrigant runs clear. Okay, so that means you're getting a lot of the sloughing off and you're cleaning your wound nicely. Now what I'm looking for is just my pink Calphalon. I know I added it. So if this was something I was missing, I would probably get my coworker to grab it for me. Oh, here it is, I found it. Okay, if I was missing it, I would grab one of my coworkers to grab it for me, open it up, and I can grasp it with my sterile gloves. Thankfully, I found it though. Okay, so we have a 30 cc syringe or 20 gauge Calphalon, and we're going to irrigate about 10 centimeters away from the wound. Okay, I'm going to start at the bottom of the wound because if I start up at the top of the wound, by the time I get down to the bottom of the wound, there's a puddle. Then I'm just going to be irrigating a puddle, and that's not really effective. I want to irrigate the tissue. My goal is to try to get some of that sloughing off and get rid of any of the debris that's in there. No, I'm not going to irrigate the tunneling. Reason being, I'm going to say I can't see the end of it, so I don't know where the end of this tunneling is. It could be deep within the patient, and if I shoot irrigant down there, it's going to sit within that cavity, and it's going to get infected and just sit there. It might not drain well. So we can irrigate our undermining here, but let's not irrigate the tunneling. Sometimes the team will have you irrigate the tunneling, and then tunnel in some new gauze, soak it up, pull it out, and that's how you would dry your tunneling. For the sake of the lab, it's hard to keep these things dry, so we're not going to irrigate the tunneling. A bit of your irrigant might get stuck in there, and that's okay. We'll just dry it the best we can. Okay, so I'm going to start at the bottom of my wound here, and I'm going to work my way up. Okay, about 10 centimeters away, and I'm going to get underneath as well. Now, I did splash a little bit around my wound. I'm going to try not to, but I'm going to try to stay within the wound. So we'll just go around the wound and irrigate underneath that undermining and all the sides of the wound there. Okay, then I would toss that into my garbage. All right, so now we're ready to dry our wound. So I'm going to take some of my nice big 4x4s because I've got a lot of irrigant to soak up. And you can make a rosette with your fingers if you want, but create a nice big buffer so that that irrigant, which is now dirty, it doesn't touch your sterile fingertips. Okay, so I'm going to kind of tuck that underneath my undermining. I'm just going to let it soak up, dab, and then dispose into the garbage. Okay, and I'm going to do that again. If you prefer, you can also use your forceps tips and make a rosette. So pulling your edges in, make a nice big buffer, barrier, and you can go inside your wound, dab, let it soak up, and dispose. And we would just keep doing that until our our wound is completely dry. Dab. And you can see I'm not swiping around the wound because it's very fragile tissue. As well, I don't want to track anything through my wound. If there was an infected part of my wound, I don't want to track it into a different area of my wound. So just that's why I'm doing the dab and dispose. Now I'm going to go to the base of my tunneling here, see if I can soak up a bit of that fluid that's there. Okay, once I'm happy that it's dry, now I'm going to clean the peri wound as well, so the area around the wound. And I have some 2x2s in here, so I'm going to soak them in the normal saline that I've poured in. Squeeze them out a little bit. You could also use your fingers for this as well. Just make sure you don't contaminate your fingers. And I think how I would clean this is, because the bum is the dirtiest part, I'm going to start away from the bum. So I'm going to go here and swab around the wound and dispose of it. And then I would probably do that again as well with another little 2x2 or even a 4x4. And like I said before, you can use your fingers again if you want. Create a rosette, dab it in, squeeze it out. And again, away from the dirtiest part. So the cleaner part of the wound to the dirtier, okay, just like that. And then I would take 2 gauzes and I would dry as well, the same way. Do that again here, creating a rosette. And just dry around here. Okay, and then dispose. So now my wound is clean, I can go into assessing it and measuring as well. So for your length and width, you're going to use a cotton tip, but you don't actually have to touch your wound. So we're going to hold it up against. Okay. And what you could do, I have a measuring guide ready, 5 centimeters. I can compare what I measured next to my measuring tape. Or sometimes as well, nurses will create, like on a paper towel, length, width, depth, tunneling, and undermining. And then when they get to each, they will snap off the Q-tip and put it next to that in their template so that later on they can measure them. Okay? If you're with a coworker, they can jot down the numbers for you if they wanted, or if you wanted them to. So now the width, again, I'm going to do the same thing. Try not to touch anything. I'll hold it up to my measuring guide. So this Q-tip hasn't gone inside the wound yet, but now it will when I measure the depth. So the deepest part of the wound, and then flush with the skin. Okay, so I could crack that off if I wanted, put it aside to measure later, or I could kind of eyeball it here, so about 3 centimeter depth. Now I've used this one, so now it's considered contaminated, because I don't want to touch my Q-tip to one part of the wound and then take it into, say, like the tunneling, right? So I'm going to use a different Q-tip, go into the tunneling, try not to touch anything. Okay, pull that out, and then hold it up. So about 3 centimeters of tunneling. So say if this was contaminated from going into my tunneling, I don't want to shove it into my undermining now. So use a different Q-tip, deepest part of your undermining, measure that up, and hold it next to your Q-tip, so your measuring tape. So about 2 centimeters there as well. I could also look at the wound bed. So I'm looking to see, and it looks about 80% granulation tissue. It looks to be about maybe 20% sloughing. And then the edges of the wound look to be dry and clean. They're not macerated. It doesn't look reddened or infected. The wound actually looks fairly good. So I would document all these findings later on in my wound care flow sheet. Now we're ready to do some packing. So remember, I have that new gauze, a nice long strip. So we would check our physician orders, and I think our physician order said to pack it with normal saline soaked new gauze. Squeeze that out because we don't want it too saturated. Okay, and you can pack this with either your Q-tips or your forceps. Just watch if you're using your forceps that you don't poke your patient. Okay. All right, and I'm going to start with the tunneling first because I need the skinniest pieces to go in there. So I'm going to start with that part first. There we go. Okay, so other options, you can see I use my forceps tips. You could use your blunt end of your forceps, or as well, you could use your Q-tip as well if you wanted. You can use the cotton end tip, or you can use the wood end tip. Okay, either of those is acceptable. Okay, so we're going to track along our wound here, travel up to the undermining, we're just going to pack that as well. So just try to make sure we don't touch the peri wound. We did clean the peri wound, but remember, it's not sterile. We just cleaned it with some normal saline. Okay, so we're going to have to keep packing that. We're just releasing enough so that it's not draping along our patient. It's nice that I have my patient positioned this way because the gauze kind of stays in place there. Okay, so what I could do as well, so my fingers are sterile. I could, if I wanted, touch the gauze inside the wound to try to get it to stay, or use my Q-tip as well. Try to keep packing this wound here. Okay. If I was concerned that I contaminated my wound, I could pull it out and start over, or try to just cut off the contaminated part. So I kind of balled it all up there because it kind of sat nicely within the wound, and then I can just move it around to manipulate it. So now you can see I still have a lot of granulation tissue that I haven't covered up here. So I would be tempted to use yet another piece of new gauze. And luckily I do have another piece here. So I'm going to use that. So if I didn't have any more new gauze in my tray, I'd have to get someone to help me out to add some to my tray. But luckily I did have some. So this would be a good idea to make sure you measured long enough. So then when I'm charting this, I would make sure that I document that there's 2 pieces of packing inside this wound so it doesn't get missed. It's pretty obvious though. You can see that there is 2 pieces inside this wound. But say if there was 1 piece tucked way inside my tunneling, we wouldn't want that to get lost in there. So we would make sure that we keep out a nice tail into the body of our wound, so that it's very obvious that there's 2 pieces inside. Oh, this is going to pack this really nicely. Okay. There we go. Okay, there. So if I did need to cut it and I wanted to keep my hands sterile, this is why it would be really handy to have scissors inside my tray to cut this, the end, if I needed to. I didn't need to, that fit perfectly actually. And then this would all still be sterile. And then at that point as well, I could lay my 4x4s, because my hands are still sterile, onto my wound. And I think my order called for 2 4x4s. Now, if I had contaminated my hands at the end of the packing, say for example, I needed to cut it, but I didn't have a second pair of scissors and I needed to grab these ones off the corner of my tray, I could definitely do that. Cut, and then from there on, I can't touch with my sterile hands anymore. I would have to move to a no-touch technique. Okay, so I would move my forceps to the outside here. Okay. And I could use my blue forceps as well. And then I would just manipulate it, but not use my fingertips anymore. Just use the tips of my forceps because those are sterile. Okay. And then to lay the 4x4s over top, I would grab them from my tray. I would lay them over top. That one looks a little bit beat up, that one. If I didn't have any more left in my tray, I could contaminate my hands and just pull it from my package. So say for example, now I can't touch that gauze, but my forceps tips can. And then lay it over top like that. And then our physician orders say just to tape it up. So that's what I would do. I would put some tape over top of there to secure it. And then I would document in my wound care flow sheet. I could also write an IPN as well to say how my patient tolerated the procedure. And that's how we would dress that wound.